Hey there, everybody. It's Dr. Aimée. Happy New Year. Today, I wanted to address one of the most frequent questions that we get asked here at Santa Cruz Integrative Medicine, which is, I'm going to get a vaccine. Is there anything that I can do to try to maximize the benefits and minimize any potential side effects? And that doesn't matter if you're getting your first, your second, or you're getting a booster. Now, for most people, first shot really just leads to maybe a sore arm, which you can ice, or you can use, I've got a few little goodies over here. My favorite little Plus CBD oil roll-on, right? This is CBD with camphor and menthol. You can roll that on any areas that hurt and get your neck while you're at it. And then it's usually the second dose for most people, the mRNA vaccines, where the immune response recognizes the spike protein that it learned from the first vaccine, and you start to feel like you have the flu, or some people think I got a mild case of COVID. There's no flu, there's no COVID in those vaccines. It is your immune response that makes you feel achy and feverish and really, really tired. I was definitely in bed for a full day after my second shot. The boosters, generally for most people, tend to not have or not pack as big of a punch, especially Moderna, which is only a half dose. But nonetheless, people react very differently. Some people have no reaction at all. Some people feel terrible. And there are a few people who really have a rough time, sometimes for days or weeks after the vaccine. And I have seen anecdotally in my practice, and my colleagues would agree, that a lot of those people are dealing with underlying inflammatory or immune issues. So when the question comes up, what can I do to maximize my benefits, minimize potential for side effects? It's lower that inflammatory response and support a healthy immune system. So leading up to getting the vaccine, definitely be on your best behavior when it comes to diet, exercise, sleep, and really practice the best self-care that you know how to do. When it comes close to the day of the vaccine, if you're able, and I know we can't all do it, but if you're able, find some time to rest. Give away carpool duty. See if you can get a day off work. Really have the space where if you need to lay down and take it easy, you can. Like I said, I was down for about a half a day. It was really nice that I was able to cover myself and not have to do a lot of work. So that was very, very helpful. So give yourself that gift. Like I said, have ice or a fun little roll-on in case you get a sore arm, which is very common, especially with the first shot, but you can feel them with all of them. Keeping, movement around too will help the soreness pass. It's like that with all vaccines as well. You might think, well, maybe I'll take an anti-inflammatory or an antihistamine because some people do have some allergic responses to the vaccines, and don't do that before you go. If you're worried about an allergic reaction, wait 15-30 minutes after the vaccine. A lot of places ask you to do that anyway. And then you can have anti-inflammatories on hand to use if you need them once you see how you do, right? You can use Tylenol or you can use ibuprofen. If you're just really feeling like you can't tolerate that lousy, achy, fevery feeling, if you can tolerate the fever, but the ache is what's really a problem, use ibuprofen instead so you can keep the fever up, let the fever kind of do its work with the immune response. Now, supplements, what can you do? So a couple things that I think could be really important. There's lots of different types of supplements out there like this, but I really love this product, funny enough, by Plus CBD Oil, CV Sciences. This is not a CBD product though. This is actually their CV Defense, and it's kind of like an immune multi. So I like to take it every day during cold and flu season. It has, I'm gonna put my glasses on so I can read it to you. It has vitamin A, vitamin D, zinc, and selenium in it, all which are really important for the immune system and a healthy immune response. And it also has some reishi mushroom and some PEA in it. PEA works in the endocannabinoid system like CBD, but it's not actually a cannabinoid. It's a natural endocannabinoid. So really supporting the stress and the immune response 2 a day leading up to getting the vaccine and after. And frankly, I think all season this is great too. If you happen to know that you're deficient in D or zinc, you can add some additional D and zinc to this. D up to 5,000 IU, zinc up to 50 milligrams, depending. Along those lines, vitamin C, super important to get your immune system jazzed up and ready to go. You can do 1 to 3 grams. I happen to have this liposomal vitamin C in the house. No big preference on this brand. It's just what I have. So you can definitely increase that leading up to getting the vaccine, sticking with that during this time anyway. Also, classic homeopathic remedy Thuja, Thuja, those little white pills that come in the little blue tubes, classic for avoiding vaccine adverse effects. And so those are those little white pellets. You can take 2 of those a day. I would go higher potency, which would be like 1M, something like that. You can get that at most health food stores. I would do 2 pellets a day for 3 days leading up to the vaccine, 2 days after, just to give your body a little extra energetic push. And then finally, and maybe one of the things we've seen be the most helpful, is glutathione. Glutathione is the body's master antioxidant. This happens to be what I have here. I know it's all backwards. It's a liposomal form, and these are little packets. This company makes it in a liquid too. You can get a liposomal liquid. Cetria glutathione is also an oral glutathione that's been shown to be bioavailable and increase glutathione levels in the blood. So you can take for at least a week daily leading up to the vaccine, and I would say for at least a week after. And if you know your antioxidant status is low from previous testing, you can double up, and no problem here. If glutathione's too much for you and you know that, you can take one of the precursors like NAC, for example, N-acetylcysteine, 600 to 900 milligrams twice a day, week before and week after. Whether it's your first, your second, or your booster, we want you to get the maximum benefit, the least amount of side effects. We know that this vaccination issue is thorny for a lot of people, and that there are lots of folks with really good questions out there. And there's a lot of information, some of it great, and some of it downright lousy, available to you. All of your Santa Cruz Integrative Medicine providers are open and available to talk to you about any questions or concerns that you may have. And of course, we wish you all a happy, healthy 2022.